We can speak now to the Chief Executive of NHS Confederation. That represents the whole healthcare system in England, Wales and Northern Ireland. That's Matthew Taylor. He joins us now live from Leeds. Thank you for being with us. I'm interested to get your take on the interview with Stephen Barclay. First, he said he wants a bonfire of the NHS pen pushers, cutting bureaucrats, axing targets for efficiency savings. Is that a good idea?
Yeah, I mean, I'm not sure about the kind of slightly populist language of pen pushers and red tape and all of that. I mean, actually, the issue here is that the National Health Service is very centralised, hierarchical system, and it generates an enormous number of targets. Now, some of those targets actually come from politicians themselves. So I strongly support the idea that we should try to devolve more power in the health service so that local health systems, working with partners like local government, can find solutions that work for them. Too often these national systems treat everywhere as if it's the same, and places are very different. And the Secretary of State has appointed Patricia Hewitt, who of course was Health Secretary of State way back in the Blair years, to try to look at how we can devolve power in the health service so we can have better local solutions. So we absolutely support that. We think it's a very good idea.
We are seeing, I'm interested to know about the state of the health service, because we're seeing, of course, long waits in A&E. We're seeing struggles to get GP appointments. We're, of course, about to go up into winter and the time when the NHS is under most pressure. Are you actually a bit worried about the health of the NHS right now?
Yes, we are in the midst of a gap, and that's the gap between the demand that we face and the capacity we've got. So, on the one hand, we have an ageing population. So, for example, the year of our lives when we consume the most amount of health and care resource is the last year of our life. And over the next decade, there'll be about 25% more people reaching the last year of their lives. So you've got population ageing, you've got the pent-up demands of COVID. You've got, unfortunately, the fact that as a country, we have high levels of poverty. Poverty is strongly connected to ill health, as your last interview vividly demonstrated. So we've got a lot of demand, but then when it comes to capacity, we had 10 years of austerity when growth in health service spending was around half of what most economists say that we need. That meant we went into COVID, there was research last week that showed this, about £40 billion less have been invested in the UK in comparison to EU countries in that decade leading up to COVID. So we go into COVID with over 100,000 vacancies, with a crumbling estate, lack of investment in things like IT, and COVID hits us extremely hard. The effect that COVID had in terms of, for example, waiting lists was much worse in the UK because we just didn't have that extra capacity. So we've come out of that, and this is the issue, this gap between demand and capacity. Now, we welcome the fact the Secretary of State has got more money out of the Treasury to deal with the impact of inflation. It's not as much as we need, not as much as we want, but we're grateful for anything that we can get. But what we really need now is consistent spending over the next 5 or 10 years, and we've got to address these two fundamental issues: 130,000 vacancies in the health service, 160,000 in social care, and a £10 billion backlog in terms of the estate. And it's only when we fundamentally address those capacity issues that we're going to get the health service that we need and that we want.
It's interesting for you to talk there about, the health of the health service going into COVID, because, of course, ministers are very keen to talk about the impact of the pandemic exclusively. Now, you're talking there about the challenges of extra demand with the ageing population and how much more health service we consume in the later years of our lives. Now, the NHS, of course, is consuming an increasing amount of public spending. I think it's almost £200 billion a year, 20% of public spending continuing to rise. Is the problem that actually money isn't the only solution, that we need reform as well?
Well, I do think we can do things better. I think we can be more productive. But the problem is that some of the ways in which we're not productive are a reflection of that lack of investment. So let me give you a couple of examples. We spend a lot of money on agency staff, and that's a very expensive way of employing people. But that's because we don't have that workforce strategy. So one of the things I really welcome about the autumn statement is a commitment by the government to have a proper medium-term workforce strategy. Take another example. Almost every hospital in England, in Wales, in Northern Ireland has got wards full of people who could go home, who should go home. Hospitals are not a good place to be if you don't need to be there. You get deconditioned. Your situation tends to kind of deteriorate. Now, it costs more to have people in hospitals than it does to have them in care homes, and a lot more than it does to have them getting domiciliary care. But we don't have that social care staff. The lack of investment in capital means that services like primary care aren't as efficient as they ought to be. So we can be more productive, but it's not about kind of cutting away at bureaucracy. Actually, we have fewer managers in the health service than most other kind of systems, large systems like ours. It's about that medium-term investment in a better health service. A health service, for example, that can be better at diagnostics. So we find diseases earlier. So we all want a more productive health service. We all want a better health service. And to be fair to the Secretary of State, I think many of the things he's talking about, whether it's data, IT, devolving power, are in the right direction. But it's going to take time. We are not in the situation we want to be in. The demand is growing, and it is going to take time for us to rebuild the health service.
You talked there about social care. Were you disappointed that there wasn't more about social care in the autumn statement?
Well, there's some more money for social care. I mean, the government faced a difficult choice, which is that most of the extra money that was dedicated to social care in last year's autumn statement was going towards the cap on social care costs. Now, the government has put that off for 2 years. That's an unpopular thing to do. But by doing that, there's more money which can go into the front line. And I think on balance, given that resources are limited, that was probably the right thing to do, because when you've got 170,000, 160,000 vacancies in social care, the situation just grinds to a halt. And if you talk to anyone in local government who's trying to recruit people into social care, the fact is that the cost of living crisis is hard for everyone, but the private sector in the end can pass on extra costs. It can raise wages. And I speak to people every day who work in health and social care, and they talk about staff leaving to go and work in warehouses, to go and work in retail, something which intensifies in Christmas. So that situation is deteriorating. So in a perfect world, there'd be more money for social care in the front line, and we'd be able to carry out the reforms that Boris Johnson unveiled some time ago. But given the choices, the really important thing is to get that money to the front line and to, for example, get those people out of hospital who don't need to be there.
It's interesting as well to hear you talking about the issue with staff in the hospitals, but also in social care as well. Has Brexit had an impact on that?
There's no question that Brexit is part of this, and the government themselves has taken measures to bring more staff in from around the world, because we have labour shortages everywhere, and they're particularly acute in health and care because we don't pay very much and because the work is extremely demanding. But yes, Brexit cut off a supply of labour, and we've had to scrabble around now to try and bring in people because, without overseas staff, our NHS simply would not work.
And then finally, hundreds of thousands of nurses have voted to strike. How much impact is that going to have on a health service this winter that, as we've already talked about, is already feeling a lot of pressure?
Well, to be fair to the RCN and the unions, they've committed to the fact that they will not disrupt emergency or critical care. But clearly, as you say, the health service under the kind of pressures I've described, industrial action is just another pressure on top of that. Now, I welcome the fact that the Secretary of State is keeping negotiations open, keeping discussions open with the unions. The government has committed to bringing forward the pay review for next year. So hopefully there are grounds for finding a way through this. But it's important to say that, even if the trade unions weren't threatening industrial action, with the 130,000 vacancies, we have an issue about how we recruit, how we retain, and how we motivate our staff. So we're going to have to look at this pay issue if we're going to have the staffing that we need. And it's not just about pay, it's also about morale, it's about the workload that people have to deal with. But at the moment, as an organisation that represents NHS leaders, all I can say is I hope the trade unions and the government continue to talk, find a way through this. And if there is more money to be made available for pay, it is really important that that money comes into the health service, because we don't have spare capacity to meet higher wage.
OK, thank you so much for being on the programme this morning. Really interesting to talk. Matthew Taylor there.
Thank you.